Jigger removal is a crucial step in managing the parasitic infection known as Tungiasis, caused by the Tunga penetrans flea. Effective removal helps alleviate discomfort, prevent secondary infections, and reduce the spread of the parasite. The process begins with proper identification of the affected area, typically where the flea has burrowed into the skin, causing irritation and inflammation. Before beginning the removal process, it is essential to clean the area with soap and water to reduce the risk of infection. The person performing the removal should also wash their hands thoroughly and, ideally, wear gloves to minimize the chance of transmitting bacteria. Tools such as sterilized needles, safety pins, or tweezers can be used to carefully extract the flea from the skin. When extracting the flea, the person should gently lift the skin around the burrow to expose the parasite. This must be done with care to avoid breaking the flea and leaving parts behind, which can lead to further complications. Once the flea is removed, the area should be disinfected with an antiseptic solution to prevent infection. This can include topical antibiotics to treat or prevent secondary infections and anti-inflammatory creams to alleviate swelling and itching. Oral pain relief medication can also be provided to ease discomfort during the healing process. Prevention strategies are equally important in managing Tungiasis and avoiding future infestations. This includes improving sanitation and hygiene practices in affected areas, such as regular cleaning of living spaces and proper waste disposal. Wearing shoes and maintaining clean feet can also help reduce the risk of contracting Tungiasis. Healthcare workers can teach proper jigger removal techniques and promote hygiene measures to vulnerable populations. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.